Hi, my name is Schenck, and I'm going to be performing the scene size up and the general impression of a patient when arriving on a call. We've been dispatched to an unresponsive female at a residence who lost consciousness with her family while at a party. Upon arriving at the scene, I'm looking around and I'm not seeing any hazards that might be present for myself or my crew. The bystanders and the patient appear to be safe as well, so we can move on and don our personal protective equipment. For this instance, I'm going to put on gloves as well as some eye protection as a basic form of safety against any bodily fluids or blood that might be at the scene. We only have one patient here, so it doesn't appear that we're going to need any additional resources. The scene is safe and stable, and it doesn't appear that we will need any advanced level providers either at this time. If we should need them later on, we can always contact dispatch for that resource. My general impression of the patient thus far is that they're sick and possibly unstable, given that they're not responsive to any of my advances or my verbal cues. We have an approximately 60-year-old female, and though no trauma seems to have been suffered, we're going to be cautious, although it doesn't appear that manual spine stabilization is going to be necessary at this time. If we were going to stabilize the spine, either me or my crew member would keep the spine neutral and intact, and then another member of the EMT crew would come and apply a cervical collar in order to maintain an inline stable cervical spine. Now, given that there were no traumatic incidences, this appears like it's going to be a nature of illness type call. So no trauma, most likely the patient is simply ill. Now, there's no obvious life threats, there's no bleeding, no deformities, the patient is breathing with good chest rise, and the airway is unobstructed. Therefore, we can say that no life threats need to be addressed at this time, and we can now move on to the next part of our assessment.